Okay, good morning, everybody. The end so near. Uh, this last bit, just like the immunology chunk of material, there is a course devoted to pathogenic microbiology to go through all sorts of aspects of disease. So, this a small smattering. I feel like really some of my most favorite stuff because I like disease, but really just an aspect of principles of micro. We want to think about all sorts of other details. Maybe we want to think about it more than just infectious disease. So uh, part of me feels like 2 weeks for 6 chapters is not quite enough time, but we're going to do it. So 6 chapters, 6 days. Hold on. Here we go. The final exam is just a regular exam. So it's not cumulative. It's only going to cover this last chunk of material. With that said, each of the chapters, as we start progressing through here, and you're going to see it in the PowerPoints as well. We're going to talk about specific body sites, and we're going to talk about different types of pathogens. And as we move through here, there will be some tables in the text that really put it all into a distilled down, easy to access situation where you can see all of the respective microbes within that category: bacteria, virus, fungi, maybe some protists or worms, just depends on where we're at. So you can kind of keep it together a little bit. So I recommend looking through those tables to get some further details. And I'm going to show images, but I'm going to try to focus in on some of the table material a little bit more so we can speed this up, because deep down, if I ramble on about pimples, we're not going to make it through here on time. So we talked before in the last section of material, the skin, really our first line of defense, the unbroken skin, providing a barrier to the outside world, but it also provides a perfect habitat for some microbes to call home. When we think of different types that we would classify as our normal flora. Dependent upon circumstances, oftentimes we think about acne as we start to approach puberty and all sorts of hormones are raging. We see lots of changes, like maybe excessive oil production that sets the stage for, it's like we've just created a buffet. Some of these microbes appreciate that excessive amount and potentially thrive. We see clogged pores and hair follicles, inflammation, all sorts of bacteria on our skin. But when we think about stuff like acne, we'll see in a second, Propionibacterium is a culprit. Propionibacterium acnes. And with a name like acnes, I think we can imagine acne is a result. So lots of different potentials as we move through here. We've talked about anatomy of the skin already. I'm not going to go through those details. All right. This image reminds me of a few chapters back where we showed the picture of the car and all of the touch points and swabbing stuff. And I know you did stuff in the lab at the very start where you had the ability to swab a little bit of stuff and see what sorts of stuff grows in the environment. This is the same sort of an idea, but the environment is yourself. So all sorts of different areas of the body with potentials for microbes to call home, or maybe not. So they've got it all divided by body sites and pie charts over here that we can look at our key and see some representative microbes that may potentially call these areas home. There are definitely regions where we see specific things residing and other regions where we can see them overlapping, right? So it just depends on the circumstances. And I'm not going to go through here and spout off all of this stuff, but you can see truly some variation as we look at these pie charts about the types of organisms, what sorts of habitat, if you will, do these areas of the body hold, and we may expect to see varied types of microbes, right? And we showed the acne, but if we were thinking something like streptococcus or staphylococcus or whoever, different areas of the body may be prime locations. I oftentimes think strep in my throat, in my mouth, but there are other regions as well. All right. And staph, oftentimes on your skin. Staph aureus, the side of your nose or up in your nose, could be prime locations. Epidermidis, really kind of all over, we could imagine it potentially colonizing. And it just depends on some of the specifics. The sides of your nose, a little more oily. All of your skin's pretty salty, which is what Staphylococcus likes. But that little bit of extra oil helps to enhance potentially finding some staph. So here we can see more with the acne. We'll talk whiteheads and blackheads. We'll see some of that stuff here in just a second. But we can see the inflammation, the swelling, and some of the whitehead, some of the pus that is forming as a result of these microbes getting in and feeding on the oils that we are secreting. So we'll see some more of that as well. There's all sorts of different types of lesions. We'll see a little of this as we progress through, but this just showing us a quick overview of some of the manifestations that we might be able to observe on the skin. So from crusts to ulcers and everything in between, it can be on the surface or moving through layers of the skin, through the epidermis into the dermal layers. Cysts, pustules, discoloration, macules, raised, all of these look a little raised, papules, wheals, and vesicles, numerous opportunities, and you can see varied areas of the layers of the skin that are impacted in each of these respective potentials. So we also talked a little bit when we were thinking innate immunity, thinking about secretions like your tears with potentials to have some antimicrobial properties. And that's really kind of what we're looking at right here with the lacrimal glands and the secretion of this. There is this lacrimal puncta, these two little pores where the tears are able to cycle through. We can see this. And draining into the nose, the nasal lacrimal duct. And there are potentials, colds and things like that, where we can see some blockages. Oftentimes with little kids, we can see issues where they get super snotty and the puncture gets kind of plugged up and their eyes get really goobered up because they can't flow through like they truly should. So I think we also mentioned a little bit about the eye. We'll get some more. And this, I'm kind of torn. Where do you put the eye when we're trying to talk about body sites? Do we throw it here with the skin infections? Should we slap it into the central nervous system infections? Where does it truly fit? Either place, I think, could warrant placement. So, with the skin organisms, there are potentials for some of our normal flora to be found on the conjunctiva of the eye. And really, I think that's why they thought this is a prime location to put these guys, because we're talking skin stuff. All right. The eye, as we move into it, should be sterile. There are definitely potentials for things to take hold, but should be a sterile environment. All right. This is also, I think this is what I was saying. I think we mentioned this before. The eye is a privileged site, immunologically privileged. Although we can see circulatory, the vessels moving in here, supplying nutrients, we don't think about a massive influx of immune cells, macrophages, and others coming in. This would cause some serious issues with our vision. All right. So dramatically minimized with that. All right. And setting the stage, if something truly is within the vitreous humor or in trying to infect the retina, whatever it may be, the potentials to truly try to combat that are dramatically minimized. So issues for sure. These pictures disturb me the littlest bit. And there's more disturbing images yet to come. So conjunctivitis, pink eye, oftentimes Haemophilus, we'll see some details with this in a second, is a culprit, but there are some others that can also fit into this. So inflammation, you can see some pus production in here, the eye super red, pinkish, pink eye. And oftentimes a single eye kind of gluing shut with all of these secretions, potentially both eyes impacted. It is a really pretty good infection, highly contagious, a great one for little kids, daycares, preschools, elementary schools. If a kid has pink eye, you kind of just imagine multiple ones are going to wind up with pink eye. They should be staying home. But sometimes that's not what happens. And sometimes you don't recognize it till a little bit later. The damage is already done. All right. This next one, blepharitis. This is inflammation of the eyelids. This poor person with their eyes getting all pulled apart. I'm like, of course they're going to be inflamed. Look at this. But this is, the pointer will come back. You can see the inflammation around the eyelids here. And then keratitis. So inflammation of the cornea. We can see this kind of clouding or discoloration as a result of the keratitis. There are numerous players with this, and we're going to hit some of this as we progress through here. So I'm going to move past that. So I believe you have worked with mannitol salt agar plates in the lab. You should have looked at some Staph aureus. Maybe you looked at some Staphylococcus epidermidis, and maybe it didn't quite look like it should. I don't know if you have had that issue or not, but I know we've been plagued with some problems with that bacterium. I think we've maybe got it figured out. So the mannitol saw agar, both aureus and epidermidis, gram-positive cocci in clusters. You see them under a gram stain. They look the same. If we were to plate them out on mannitol agar, salt agar, both of them grow, but only Staph aureus is able to ferment the mannitol, and it turns the medium yellow as it alters the pH, makes it a little more acidic, and it goes yellow. All right. The epidermidis growing next door doesn't ferment the mannitol, so the media stays pinkish red. All right. Kind of cherry red, really, if you got some good MSA plates. All right. You can see the colonies, the epidermidis kind of looks a little bit yellowish. All right. Really kind of more good ones, I feel like, more white colonies. And you're seeing some yellow over here, but it's not the result of these bacteria, it's the ones next door. And they're super good at fermenting this. So as they shift the pH, if you gave them a little bit of time, maybe cooked them up a few extra days, this whole plate might end up turning yellow because the aureus was able to really alter the pH enough that the whole thing changes colors. All right. So growing them side by side like we have here is okay, but you don't want to grow them for extended periods of time because then you might wind up with something that doesn't make sense. As we see here, it's already moving over into it. All right. Both of these, you probably did some biochemical tests with the staph. If you put a drop of peroxide on either of these, they would bubble, showing that they're catalase positive. But truly, to differentiate, the MSA plate does a great job of showing the difference between these two. And aureus, oftentimes thought of as being truly more pathogenic than epidermidis. Epidermidis holds some capabilities of being a pathogen, but oftentimes we just write it off as normal flora. You'd expect it on your skin. Technically, you expect aureus on your skin as well, but it has greater opportunities to get in and take hold. So here we go. And I'm pretty sure YouTube has already been marked. This isn't for the kids. And I'm pretty sure this image or maybe one coming up that they're like, yeah, no, you're flagged, right? I'm like, don't flag me, don't bar me, right? I need to show these things, right? All right, furuncles and carbuncles, boils, and truly carbuncles are the result of numerous furuncles merging together. All right. So little different. All right. But same sort of idea. All right. You can see some of the pus production here, a little bit of yellowing as well. Staph aureus, the name aureus means golden. All right. And you can kind of see a hint of that. There's redness and inflammation around the lesion, indicative of infection. All right. The swelling that we see here. So next door, bed sore. So pus filled, as you can see, and deeper than the furuncles. But like I said, it's multiple ones coming together and truly driving deeper into the tissues. And these truly, we think about people, in bed, hospital situation. It's important to move these patients, rotating them around a little bit to prevent these situations. And when it truly emerges like this, it becomes very difficult to treat, right? The monsters inside me that we saw talking a little bit about some parasites to combat stuff. You don't want to go get yourself some worms for this, but in some instances, treating with maggots ultimately can make this wound heal considerably faster. And these, you don't just open the window and let flies in, all right? These are sterile flies, laboratory reared. They're not harboring disease. They haven't been outside feeding on some dog crap and then flying in the window. You probably don't want that, right? But these sterile maggots feed on dead tissue, leaving the living tissue alone. And so they clean up the issue and allow for the wound healing to really kick into gear. I think that's pretty interesting. And it makes me wonder, nobody in here said they would infect themselves with worms, but if you were rocking a bed sore like this, would you let maggots on you? I see one nod, one yes. And I see a no. You're like, hell no. Just can't you rub some cream on it? All right. Staphylococcal scalded skin syndrome. This infection results while the child is in transit through the birth canal, gets infected with staph, and I think maybe fortunately all we're seeing is his little fist pissed off, right? Uh, the whole body kind of can look like this. The scalded skin, it looks sort of like you've just been dipped in boiling hot water and pulled out. The skin is sloughing off with lots of infection covering the surface of the body. All right. Next is impetigo. This we will see in a second is a co-infection. There's two players that are involved with impetigo. Staphylococcus aureus and Streptococcus pyogenes working together to create kind of this perfect situation. It's another good one for a childhood illness. It is easy to transmit as well. And often, not always, but oftentimes we see it on the face, around the mouth, pretty common. All right. But it can be elsewhere, but usually more common to see it around the mouth. So we'll get to some details here in a second. So the Streptococcus pyogenes, we showed you the aureus a second ago, although it wasn't gram stained, it was the electron micrograph, but clustered up cocci. The pyogenes forms nice chains, all right, Streptococcus pyogenes. And really, it takes a bit of practice to deal with this. I think if you didn't see some of this stuff and all you saw was this, you might be thinking staph, right? Because it doesn't really look chained up. A little of it does, but a lot of this, you might say that looks clustered, all right? But really, it's handfuls of chains kind of all sort of clumped up together, really, all right? And moving to an area of the slide where your smear's maybe not super thick, where the cells have had the ability to be thinned out a little bit, might give you an opportunity to see some more of this chaining appearance. And you'd be like, wait a minute, all right? If you truly were uncertain and you have this stuff growing on your Petri dish, and you're like, I think it's strep, but maybe it's staph. You could quickly take a little bit of this organism, put it on a microscope slide, put a drop of peroxide on it, and if it bubbles, it is a staph. But if it doesn't bubble, you're like, okay, these really are chains. This must be some streptococci because they don't have catalase, all right? Catalase tests, very useful when we're trying to differentiate maybe based off of a gram stain that we're not quite certain with, can clue us in super quickly, all right? You also could put a drop right on that Petri dish. If you're growing them up on a blood agar plate, probably not the best idea because you're going to see some bubbling with that as well. So with that impetigo, Streptococcus and Staphylococcus working together, all right? Focusing still with our Streptococcus. Like I said a bit ago, I oftentimes think mouth, strep throat, but there are other opportunities, and we can see different skin manifestations with pyogenes, and ultimately getting in through a wound or something like that that may lend to it in areas where we may not expect it or want it to be. So cellulitis, ehrlichias, as we see this rash on the face and kind of peeling skin, and then erythema nodosum, it's hard to see, but kind of little lumps or nodules as a result of that. Kind of looks like you got that going on right there too. Uh, maybe, maybe it's the same person, right? So, and these typically on the legs where we see that. This is the one that I really think YouTube was like, wait a minute, right? This is disturbing. I won't leave it on this for too long. So necrotizing fasciitis, there are a handful of microbes that have potentials to be flesh eating. That's really what we think about with this. So pyogenes is one of them. There are some more we'll hit on as we progress through. So we see all of this infection here. A lot of this discolored blackened tissue is necrotic tissue, dead tissue, necrotizing, all right? And the fasciitis basically getting into all of your muscles as they're all coming together, the fascia holding them into their groups, it moves into that and starts destroying. So removal of this dead tissue is what we're seeing over here, surgically debriding to get rid of that. And likely multiple skin grafts are going to be needed to truly deal with this after it's been removed. Truly depends on these culprits. Sometimes the solution is amputation, all right, to deal with that, all right. Crazy. Moving over to Pseudomonas. Pseudomonas is gram-negative rod. Pretty common to see kind of in some environmental situations. And it's a culprit for something that initially sounds like it might be fun. A little hot tub folliculitis. Who's game, right? Maybe not, right? I don't think you want it. So it looks similar to acne, all right? Sort of the same idea. So the bacteria gets into these follicles and starts to grow. We see the inflammation. This could be all over your body as you are in there soaking in the hot tub. The potential for the bacteria to get in and colonize can result in this, all right? And it likes warm, wet environments. Hot tub folliculitis. Maybe while you're in there, you dunk your head under as well. So Otis externa is swimmer's ear, and this is our pyogenes as well. They are super good at producing capsule layers, forming biofilms, and pus production as well is what we're getting in. They're more than just their own capsule. So that's swimmer's ear, and it's the outer ear, all right? So painful swelling issues, all right? And kind of makes sense that swimmer's ear and hot tub folliculitis, they go together, all right? So I think you've also worked with some Pseudomonas. The Pseudomonas, it depends on the type of media, truly, but there are numerous types of media where the Pseudomonas, as it's growing, it turns the medium green, all right? They produce some pigment called pyocyanin, secreting it to its environment, and you can see this greenish production. The first image is really trying to show the capsule layer where you see the shiny colonies, pretty indicative of a polysaccharide secretion from that bacteria. And they also have the potential to fluoresce, producing this fluorescent when looked at with a black light, they glow in the dark. So there are a couple of different Pseudomonas species that have some pretty good glowing characteristics with that. It's a good one for not only the folliculitis or swimmer's ear, but burn situations where you've got a patient with some serious, severe burns, third-degree burns. Pseudomonas can get in and colonize, and this greenish looking appearance on the plate. The pus in individuals infected with Pseudomonas is this greenish color. All right. Interesting. All right. Uh, it also has an interesting odor to it. You've maybe smelled a little Pseudomonas in the lab, maybe not. All right. Uh, Lots of times, back to the Pseudomonas before this acne. And you don't want to just take a petri dish and just smell it. That's ill-advised. But sometimes just opening up to get your loop in there and deal with stuff, you can get a little bit of a smell. Most stuff smells pretty bad. All right. E. coli doesn't smell so good, right? As you imagine where it's coming from, it probably ought to stink a bit, right? Pseudomonas has a handful of different odors that have been described. Oftentimes, textbooks say it smells like grapes, and it smells more like artificial grapes. I think of the Hubba Bubba bubble gum, the grape bubble gum, or grape chapstick, right? It can smell like that. I've smelled that maybe twice, all right? Uh, Usually, when I smell Pseudomonas, I smell corn tortillas. That's what I smell. And to me, thinking of all of the other gross smelling bacteria, a little bit of corn tortilla, I'm like, that one smells pretty good. All right. Uh, Unless you flat out hate corn tortillas. All right. Then maybe not so good. All right. I had one student say, man, this bacteria smells like Les Schwab, smells like new tires. I'm like, what the hell? I've never smelled a new tire. All right. I've smelled new tires, but I've never smelled a new tire smell from bacteria. All right. But interesting, all of our sniffers sniff a little bit differently. And what I might be saying is corn tortilla, another person probably would say grapes, right? Just depends, all right? I've never smelled corn tortillas that smell like grapes. All right. Did anybody get a whiff of tortilla in the lab? No? Okay. Grapes? Les Schwab? Nothing. All right. Maybe you never even worked with Pseudomonas. I bet you did. All right. So here's our acne. The normal, the whitehead as we get in there, and then potentially clogging it up. That's the blackhead. And we can see some issues with that around the side of the nose. So this, as we've started to not only feed on these oils, but oxidizing them, that causes this darkened appearance within their clogged pores. All right. Skin stuff. Anthrax has multiple potentials, but typical infections with anthrax, we think of it as a skin infection, cutaneous anthrax. Back in the day, it had a common name of wool sorters disease because sheep herders or the people shearing the sheep, maybe that's not the sheep herder, the people working with those sheep and shearing them, pretty common to get some skin infections as a result of it. Hides of other animals also potentially harbor it, more than just sheep. All right. Bacillus is a gram-positive bacteria, gram-positive rod, and it's aerobic. So it can be out in the environment. The bacteria could get on the hide of this animal. The viable cells or potentially spores of the organism could be there, and they could get inoculated into the skin of the handler, potentially abrasions, cuts. Maybe as you're shearing them, you nick your finger and you inoculate some bacteria in there. Multiple ways, all right? So it also causes necrotic tissue, but nothing like the necrotizing fasciitis that we saw with our pyogenes a second ago. So smaller nodule, a black eschar, is what we call that. And if we were to take some of this lesion, a little scraping from the edge of the lesion and plate it out, we would get our organism growing. This on a blood auger plate. You can see we took a little to stain it, probably. These bacillus grow kind of as a swarmer, so their colonies spread out, become very large. And if we were to stain them up, we'd see nice positive rods, potentially some spores inside of those cells. They also a little bit beta hemolytic on these blood auger plates, not as much as our Pyogenes or aureus would be. So these are the tables. For our skin infections, there are a plethora of different types of infections. And as you can see, as we move through here, some overlap for sure. Aureus mentioned repeatedly, same with Pyogenes, all right? As we progress along, you'll see, not in this, but you'll see others mentioned repeatedly. And as we get into body site, as we start moving through body sites, you'll see some of these as well. Aureus and Pseudomonas and Pyogenes repeated, all right? So lots of those. I already hit most of that stuff. So here's our conjunctivitis, bacterial conjunctivitis, because you also could have viral conjunctivitis, all right? And the manifestations are definitely different. So with bacterial conjunctivitis, it's purulent. This pus, there are cells, bacterial cells, dead neutrophils. There's a lot of stuff within there. Redness of the conjunctiva and the whites of the eyes, all kind of bloodshot. So yellow, green, or white discharge, and potentially kind of gluing the eyes shut, especially if you just woke up, all right, all sealed shut. So viral types of conjunctivitis, it's not purulent, right? You don't see this. You've got a lot of watery, clear, but not colored, all right? This image is a newborn with gonococcal ophthalmia neonatorum. This, along with some others, but this for sure, is one of the main reasons why all of the fresh hatchlings are treated with antibiotics. Right after they come out into this world, they put some in their eye. It's more than just gonorrhea, but this is definitely a main one, all right? So if it's not dealt with, blindness truly can result. So everyone is treated. Even if mother claims to have a clean bill of health, they still treat, all right? Unless you are not born in a hospital, you will be treated this way, all right? Crazy. Trachoma, this another situation, and this I think is just disturbing to look at. So it needs to be treated with antibiotics and needs to be dealt with very early. It can cause scarring of the eyelid, can lend to trichiasis, which is what we're seeing next door. Basically, the eyelids kind of folding inward, and the scarring and all of that can result in some serious issues and potentially lending to blindness as well. So that's what we're looking at here, is those eyelashes have flipped inward. Disturbing. So Haemophilus, like I said, Haemophilus influenzae, we think of with our bacterial conjunctivitis and the purulent discharge, all right? It is contagious. We think about exposure from the secretions from infected individuals being shared. And with little kids, touching all sorts of stuff at the daycare or wherever has the opportunity to create an opportunity for everyone to get pink eye. For the keratitis, for the bacterial forms, Staph epidermidis and Pseudomonas aeruginosa can be culprits with that. We'll talk about some other players in a second. The neonatal conjunctivitis, Neisseria gonorrhea was the image that we saw, but chlamydia trachomitis, the other one. And both of these, the antibiotics to ensure that it doesn't happen. And then trachoma with the granular conjunctivitis, same. Chronic conjunctivitis and potential issues with the eyelids. So I like this one. I can't move on without saying it. So transmitted by infected individuals, contaminated fomites, so touch in your eye and touch on other stuff, or by eye-seeking flies, little flies that would like to feed on your tears and potentially transmitting it from one host to another. That's flat out disturbing, right? I read some article, this was a couple of years back, it wasn't flies, they were little bees. And they found these little bees living inside of someone's eye, feeding on their tears. If that's not nightmare worthy, I don't know, right? I should get a picture of it. All right. I'm sure there's one out there. All right. Warts. We're shifting gears to some virus now. So all sorts of different shapes, all sorts of different locations where we may find them. Plantar warts on the toe, this one on the eyelid, a filiform wart, all sorts of opportunities with this, all right? And we'll hit some details as we move to a table in a second. The next one are cold sores. This is HSV1, herpes simplex virus 1. We will talk type 1 and type 2. Type 2 really more for the genitourinary tract infections, but deep down, they can manifest themselves in either location, either one of them, all right? I often like to think of type 1 upstairs, type 2 downstairs, but doesn't have to be that way, all right? So this kid right here, he always makes me laugh. He looks pretty stinking happy, right? Just hanging out. He's doesn't really mind, all right? So a couple more viral infections where we see skin manifestations. Rashes are really what we're thinking about. Roseola, pretty common. Childhood illness, mild viral infection, and you kind of just assume your little kid's probably going to get this, all right? It is something that resolves pretty quickly, all right? So often starts with symptoms that kind of mimic a cold. And then we see pink, patchy rash. It starts on the trunk and then moves to the extremities, all right? And that's what you can see here. Next door, a different virus, fifth disease, and they call it this because they say this is like the fifth viral rash infection that's super common in kids, all right? We'll see some details with this in a second, all right? So sort of a slapped cheek appearance that we see up here, and rash, trunk and extremities characteristic, all right? Both mild infections, all right? But likely something that still may warrant a trip to the pediatrician, all right? I recall with my youngest a bout of roseola, and I see this stuff. I talk about it a little bit. I see it on him, and I'm like, I think he's got this. And I pull out my big fat medical dictionary, a wealth of information, and I look it up and I read some details about it. I share that with my wife. I tell her there's really nothing they're going to do about it, but he's got a pretty good fever, right? We still need to go. So we go to the pediatrician. They look at him. He looks at him. And leaves and comes back with his book because he knows that I do this stuff. And he rolls in with his book and we geek out for a little bit talking about roseola because that's exactly what it is. And he's showing me pictures and he's talking about the stuff. And I'm like, that's exactly what I just read about. I knew it. What do we leave with? Nothing, right? Wrote the check, right? Left with less money, all right? But there you go. And mom has peace of mind, right? Knew it, right? I'm not the kind of doctor that can prescribe those medications. I can just say, I bet you that's what it is. You ought to go to the doctor. You ought to go to the real doctor, right? There you go. All right, so numerous viruses. Fifth disease, a type of parvovirus, similar but not the same as parvovirus that you might think about in little Fido, all right? Different idea, but same sort of grouping with that, all right? Most all of these pretty contagious, and we think about coming in contact, droplet, secretion, something like that, all right? So, no treatment with it. The herpes keratitis, there are some treatments, antivirals that can be utilized with it, but herpes virus, once you were infected, you don't get rid of it. It takes up residence on nerve cells and can come back. These just help to get the symptoms subsided and potentially prevent the flare up in the first place. So keratitis, the eye, oral, all the same stuff. The warts, human papillomaviruses, there are boatloads of different types of these viruses that we can see. And we will talk papillomas when we get into genitourinary tract infections, genital warts, and cervical cancer, potentials with some of these culprits, and some, not here, but some vaccines providing protection against some, right? Not all of the HPV strains. So thinking on the skin, topical salicylic acid, wart remover as a potential. Roseola, human herpes virus 6 or 7. Both of these have the potential for roseola. Cold-like symptoms, fever, pretty high fever, 103, 104 maybe. That's not so good. I think our little dude was about 103. That's an issue. And treating with Tylenol, trying to get the fever to break, doesn't. It's still elevated. That's when there's some concerns. All right. So that's the idea with it. And then the viral conjunctivitis, like I said, with it compared to the bacterial, non-purulent discharge, more mild for sure. All right. It's a good one to see with common cold, where you can get a bit of conjunctivitis as a result of that. Whoop. Oh, the fungi. I'm not going to have enough time to finish all of this, but we'll get through as much as we can. The tenias, these are all sorts of different types of fungal infections at various areas of the body. There are a lot of overlap with the fungi that can cause this, these different types of skin infections. And we sometimes give them names based off of where we're at. Tinea barbae is barber's itch. Tinea capitis would be up on your scalp. Tinea pedis on your foot. Tinea cruris, I believe is how you say that, in your groin. They call that jock itch. All different types of body sites, but the fungal players, some overlap, all right? So trichophyton, as we see right here, is one of these culprits. And we can see in the last frame, ringworm, all right? Initially thought to be a worm, and given the name Taenia for worm, but they're not worms, all right? Taenia sticks, but they're not worms, all right? They are fungi, all right? And, you know, it kind of looks as if maybe there's some sort of worm making this ringworm under the skin. This is a good one for it's good one for anybody, but a good one for little kids, especially if this little kid just got a new pet, a kitten or a puppy. They're pretty good for harboring some of this. They get ringworm, kid gets ringworm. You got to treat everybody, all right? And if you're only treating your kid and your little kitten's got ringworm, you're going to have to treat your kid again because they will get it, all right? They'll get reinfected. And like athlete's foot or any of these others, it's not a quick fix. It requires prolonged treatment to truly deal with that fungal invader. All right, we'll stop with that and talk a little bit more of the fungi Wednesday.